studies are very clear that metabolic syndrome increases the risk of prostate cancer detection, diagnosis, and poorer prognosis. So they end up doing worse. High blood sugar, big waists versus hips, hypertension, all these things are metabolic dysfunction that it's associated, could be causative, maybe, to things like cancer and prostate cancer.
This is DrTalks.
Hi, everyone. This is Dr. Joseph Anton, your co-host for the Fasting and Longevity Summit. As I mentioned before, we're expecting north of 100,000, maybe 75 to 100,000 people watching us here today. We've taken care of women's health with 2-3 episodes focused on women's longevity and health span. We focus on menopause, we focus on postmenopause, on breast cancer, and women's health in general. Today, we're going to take care of men, mainly men's lifestyle and prostate cancer. And we have one of the top national experts on this topic, Dr. Geo Espinosa. And doctor, you have a fascinating background, naturopathic doctor that actually excels at NYU Langone, right? When I went to med school, we were like, that would have never happened.
Never.
But you're such an exceptional functional medicine practitioner that you've proven that this is a discipline that changes people's life, changes men's life. Prostate cancer is not a cancer that people die from in 3 months. It's actually a lifestyle. It becomes a lifestyle and they end up dying from cardiovascular health conditions. So lifestyle medicine, functional medicine is very necessary and proven that it increases the health span or at least the longevity of those patients. I cannot wait to talk to you about all this. You also have your podcast, Dr. Geo. Is it the Dr. Geo podcast?
Yeah, the Dr. Geo Prostate podcast. And it's one of those things that, well, I should have started way longer. I started about 2 years ago, and I'm having so much fun with it because I get to interact with people like you all the time. And I love that aspect. I love dealing with and working with patients, of course, and I love having discussions with experts from around the world on their respective fields. So yeah, it's a lot of fun.
Yeah, so welcome. I would love for you to elaborate a little bit on the introduction I made.
Yeah.
I'm always fascinated how things are changing fast in the world of functional medicine, in the way how allopathic medicine is coming along to join force with functional medicine and how people such as yourself are leading this movement, starting in New York and other faculties. So please, a few words about yourself, and then I want to tackle men's health, prostate cancer, and longevity.
Well, again, Joseph, thanks so much for having me on your summit. And thanks for being on my summit, the Prostate Cancer Summit, which is part of DrTalks, and I had a great time speaking with you on that as well. I guess long end of it is I took the road less traveled, perhaps, right? So here I am over 20 years ago. I'm doing my clinical work as a naturopathic medical doctor. And most naturopaths and functional medicine doctors become general practitioners. They see everything, or a lot of them focus on women's health. So remember back then, I said, you know, I for some reason I was seeing more men than anyone else. I said, this is interesting. I didn't pay attention to that. And then I started working with a urologist even before I finished my clinical work as a student. And I was like, wow, this is amazing. Wow, I love feeling prostates. So who would ever say they love, sticking their index finger up someone's butt and feeling prostates? So once you feel like, wow, this is amazing. I love doing this. I love figuring out, wow, this prostate feels like this, that prostate feels like that. I enjoyed that. Testosterone, erectile dysfunction, prostate cancer, and all these things. I was like, wow, this is fascinating. Then the other element is, well, I'm a man, and eventually I was much younger then, but I'll be aging. My father always had prostate issues, and he was still alive at the time. I said, well, I like to help my dad with, so I'm going to stay in this path. Of course, everyone else is saying, Gio, what are you talking about? Men don't go see doctors. Gio, you're not gonna succeed if you become a male health doctor and just in urology. You're not going to succeed. And that was tempting to kind of, do what everyone else did. Bottom line is that I had great opportunities. I was mentored by Dr. Aaron Katz, a medical urologist from Columbia University. I did a training at Columbia University at the Center for Holistic Urology at the time. And then I've been at NYU Department of Urology for over 15 years. So when you say that things have changed, they have. not fast enough. I think if you just present things with information that has a scientific backbone to it, which is very important, I think it becomes more appealing. And that's what I did. I learned, everything I needed to learn from a urological standpoint. I know medical urology very well, though I don't practice it. And then I just applied, evidence-based, functional medicine, naturopathic medicine. And so that's why we're having this conversation because, man, I tell you, there's very little products and approaches that have a science-based background or a science-based backbone like fasting mimicking diet. So I'm super stoked to be here with you.
Well, it's fascinating to see, or it's fascinating to see, functional medicine doctors adopting the scientific fasting or the fasting mimicking diet. Can you talk to us a little bit about where does fasting and the fasting mimicking diet fit within the longevity journey of men with prostate cancer and or with cardiometabolic health issues?
All right, so let's tackle one at a time, and I know that they could be both together, but so prostate cancer. I wouldn't say that, I think some people think that, hey, prostate cancer, no problem, I'll never die from it. Not necessarily true. About 32,000 people do die from prostate cancer. These are men and when I see men sometimes in my office, oftentimes they have a PSA, that's the biomarker that for the prostate, in the thousands. And so they already have metastatic prostate cancer. So I wouldn't say no one dies from it. I would say most people that get diagnosed with it die from something else. That is true. But again, not everyone. So when you are putting together protocols for a patient with prostate cancer, you're trying to see, who is, 10 patients with prostate cancer are 10 different situations. One scenario is, well, you just got diagnosed with prostate cancer. Great. But it's low risk. So now you could be on active surveillance. This is a low risk, low Gleason score. You don't need to be treated. You could be surveilled and so forth. This is the guy that has LDL extremely high, high glucose, inflammatory biomarkers, clearly has a metabolic issue. And that guy will definitely die, if anything, from a heart disease and not prostate cancer. Then the other guy with more advanced disease who can die from prostate cancer, there again, fasting and fasting mimicking diet helps. So, well, again, any scenario, the studies are very clear that metabolic syndrome increases the risk of prostate cancer detection, diagnosis, and poorer prognosis. So they end up doing worse. Just metabolic syndrome, right? So high LDL, bad cholesterol, low HDL, high blood sugar, big waists versus hips, hypertension. All these things are metabolic dysfunction that it's associated, could be causative, maybe, to things like cancer and prostate cancer. So fasting mimicking, pilot study in 2023 in Nature, in case you don't see it clinically, which you do, just in case is not seen clinically, which if you do FMD, you see it clinically, showed that metabolically patients do so much better, which again reduces the risk of dying from a heart attack, even though they're coming in for prostate cancer. It's equally important. It's very important for the listener to know here you don't have a prostate coming into your office. You have a man who has a prostate coming in. So the question is, I'm assuming you don't want to die from prostate cancer, but I'm also assuming you don't want to die from other things prematurely. Is that right? Because you have to have that kind of conversation with patients and kind of redirect their focus.
And so, doctor, do you want to explain to listeners here why we're assuming that in most cases or in many cases, a prostate cancer patient, you explained that the risk for it is metabolic syndrome, which is, the cholesterol, triglyceride, inflammation in the body, etc., blood pressure, blood sugar. But why men with prostate cancer die mainly of aging and metabolic health condition? Can you clarify that? Because in most other cancers, people die from the cancer. Can we explain the connectivity so that people understand why we're talking then fasting in that case afterwards?
All right. So there is a scenario where too many men are just diagnosed with low risk prostate cancer that they'll never die from. So part of it is just our screening process. That has changed as well, but it used to be like, hey, high PSA, get a biopsy, and you just go down that process. That has changed a little bit so that we find only the type of prostate cancer or the person with prostate cancer that we should find and leave the other people alone. So over screening could have been one of them, certainly in the past. The studies show very clearly that when we say most men die with prostate cancer, not from it, that's because they've looked at hundreds of men after they died at any age, and they died from other causes, accidents or what have you, and oh wow, they have prostate cancer. So they never died from it. They just got some of them never got diagnosed with it. So that's the scenario. So the number one, I mean, look, I'm a prostate cancer guy, but I'm also a longevity male guy. And the number one cause by far of people dying prematurely is cardiovascular disease. Not even
Yes.
close. Like right now, we've been, I don't know, talking for 20 minutes or so. There's probably 10 people around the world that died from a heart attack as we speak right now, 10 men. So it's a very important, you never want, and look, just the C word is a powerful, fearful word, right? You have the psychological element, Joseph, here is amazing. So here we have CEOs of a company run 10,000 employees. You have prostate cancer. All of a sudden, everything shuts down, and it's almost like they're not even listening anymore. So as I'm trying to say, or the die, hey, but it's okay. I mean, look, you could still die from something else. They're not listening. It's the C word. So to me, is an opportunity for men to like, okay, well, I'm going to take action now, do something like fasting, mimicking, and then follow dietary protocols that I have, lifestyle protocols, and stay on it to reduce the risk of dying from prostate cancer, but also reduce the risk of dying from cardiovascular disease, Alzheimer's, type 2 diabetes, and all these other things.
And I want to make this message very crisp, right? Most men with prostate cancer die from cardiovascular disease. That's a big statement, right? This is what we're trying to say here.
Most men,
To help.
absolutely.
So for every person who has prostate cancer, or for your wife or the daughter thinks, looking up at her father with prostate cancer, take care of the cardiovascular system. And this is why in this summit, we're talking male longevity, we're talking fasting. We're not saying do fasting to cure the cancer. We're saying the fasting and the fasting nutrition, fasting mimicking diet have proven that they can help cardiometabolic health, which is the number one killer of men with prostate cancer. And that was the biggest message. And thank you for clarifying this, Doctor.
Percent. Let me add one other thing, Joseph. I think it's very important, and I'm glad that you're kind of highlighting on that. It's very important that people listening, they get diagnosed with prostate cancer and say, well, I don't have to worry about it. Let me, when you're doing something like a fasting mimicking diet, and then you do health practices, you're reducing the risk of everything, of dying prematurely from many things, not just prostate cancer or cardiovascular disease. The other thing I want to say is, and this will be, this will be harder to prove, but there is anti-cancer activity through the process of autophagy that helps with cancer itself. So as part of a protocol, I mean, look, when my patient said, look, I'm going to undergo radiation therapy around my pelvic area for prostate cancer, guess what? I either have them fast or have them go on FMD while they get their radiation, because some studies suggest that the cells are more sensitive to both chemo and radiation during this autophagy phase rather than not being on that. So it can work congruently, synergistically with other harsher treatments. Their side effect profile are not as harsh, and potentially harder to prove. There's anti-cancer processes and activity taking such an approach.
I One of the things that I always mention in the summits and in the talks is that doctors themselves do the prolonged fasting and mimicking diet. I'm very proud of that because I've always watched doctors prescribing things and recommending things to their patient, but we as physicians, we're the least adopters of any diet or any pill.
A
And,
thousand
and
percent.
one of the biggest pride we have at the Prolon with the fasting mimicking diet is that the doctors read the science, they're convinced, and they do it themselves. So, Dr. Geo, have you done Prolon? Do you prescribe it to your patients? Can you talk a little bit about your experience with it and how you try to help your patients with it?
I do Prolon FMD 3 to 4 times a year. So I try to do it quarterly. And so I'm up again now in November to do. I'm not sure if it's the last one before the year, but I may do two actually before the year. That's because I've slacked off and I need it. So here's my experience. Number one, let me emphasize what you said. Physicians, look, if your physician is not doing much of what he's telling you to do, I don't know, that's an issue there. If they don't look healthy, there's an issue. I'm sorry, there's an issue. I try to do, and not only me, many of my colleagues try to do many of the things we recommend. If not only for our own health, to see what your experience is. Before I tell you, and I know this because I didn't do that initially. I used to recommend these diets that I didn't do and all these exercise protocols that I didn't do. And people were coming back and say, this is crazy. This is too hard. Once I started doing what I recommend people to do, I said, oh, wow, you know what? Absolutely. How can a working man with 3 kids ever do this? So would I recommend things that are doable, very prescriptive, and with good outcomes? Fasting mimicking is one of them because, hey, I first of all, I work a lot. So I wanna be able to work and not feel so crappy that, "Man, I need to go to bed," and so I think the FMD program helps you with that process versus just a water fast, which I've done. I think water fasts are great, honestly. That's my opinion. I've done it, but when I did it, guess what? I didn't have children. This is before I had kids. This is before I had the kind of work that I have now. So I had a part-time job and going to school and things like that. So I could afford, you know what, I don't feel well. Let me just go take a nap for 2 hours in the middle of the day and maybe feel better. No. With the FMD approach, there's enough coming in that it keeps me stable with the Nutra drink and the soups and those bars. Boy, I tell you, I never appreciate those crackers. Just call them crack. Just call them crack. Those crackers, I never, so I think I have an eating addiction, right? So everybody's addicted to something. I think, growing up, my parents grew up poor, come to the US, eat all the food, no matter what. You got to eat all the food. People are dying in my country. People are dying in Africa. So then from that, and then I became a football player, which is you take the pride of eating a lot. So then you develop a food addiction. So, and then it doesn't go away that easily. So during this time, one of the things that helps me with FMD is kind of resets my relationship with food, by the way. So after I'm done, I'm like, okay, I'm more in control. So part of, I guess, being a food addict, you eat fast and you eat just like,
Yeah.
when you have these crackers and there's only but 4 or 5 that that you can't have more, you cut a little bites, you kind of savoring each moment, each experience with a little bite so it can last a little bit longer.
You develop the pleasure of eating, right?
Develop the
A
pleasure
lot
of
of,
eating and actually tasting things better.
this is important. They based on my experience, and I've been working on obesity and diabetes and nutrition for a decade and a half now. There's 2 things that if people learn, they're probably gonna balance their lifestyle and their weight is no snack late at night. If you sleep a little bit hungry, that's the number one biggest secret.
Drink some water or something, yeah.
And number 2, so get your dinner early and then sleep a little bit hungry. That's a sign of, for me, it's very important.
I love that.
Number 2 is enjoy the food by eating slowly because you're allowing time for
Yeah.
at least, what is the GLP-1? It's exactly that feedback that comes from the stomach to the brain. And allow time for the body to tell the brain, I'm getting close to satiety. A lot of people that struggle with weight gain are actually eating fast. And guess what? They eat fast, they eat a bigger volume, and they don't enjoy their food. When you start learning eating slowly, you enjoy your food and you start losing some weight. So this is part of what Prolam does. The number 2 benefit with Pro, number 1, people love the weight loss and the muscle protection and therefore the high energy. Number 2 that they talk about Prolon is changing my relationship with food. And that's critical. We just published an article showing that people who do Prolon exercise or the fasting mimicking diet, they exercise 4 hours more naturally within a week. They just add 4 hours natural change of, so they're healthier lifestyle, not just with the nutrition, but also with exercise. And And I'm happy you touched on those points as well. And the personal experience is always what clicks with people. And seeing the doctors on this podcast, on this seminar, I'm accentuating the doctor experience because I think there's nothing that could match that. When I see my doctor doing that product, when I see my doctor fully vested, I know the science is there because my doctor's not going to touch it if it's not. Then I know it works and I know it's feasible and I know I should do it.
Look, absolutely. And so, and the other thing I've noticed is the following. The crappier I feel when I do it, that means that I misbehaved dietarily prior to. So it's a
Yes.
signal telling me, because I've done it other times where I've been more focused, I guess, and more disciplined with my dietary approaches. And it, by the way, it's not like my dietary approaches are horrendous, but they get bad enough. I have children and we'll go out eat pizza. And sometimes maybe it's too much pizza that I'm having or whatever the case is, right? So it's also telling me, it's giving me information of how poorly my diet has been prior to doing FMD. And the more disciplined I am with my diet, the less poorly I feel while I'm doing FMD. So it's also telling me, you know what, you did, so part of that struggle and process, I think it's a beautiful process. I think it's one that, no one wants to feel crappy. I would say this, feel a little crappy. It's actually really good for you. Feel a little crappy. And that's also telling you the more crappy you feel, then the more poor your diet is prior to, and so forth. And I've exercised during it, and I've exercised at different levels, kind of trying to feel it out to see, well, let me go a little bit more aggressive. Let me lift weights like I do. I do martial arts. All right, I'll go. And it's just a wide experience that I have with being sedentary during that time, moderate exercise, and then heavier exercise through that period that I've been able to make the adjustments and do it successfully. I lose 8 pounds. I lose a couple of inch and a half off my waist. Everything is great.
And how about the emotional experience going through it? You and I were talking a little bit before
Oh
we
man,
started recording.
it's up and down. And again, I am in favor of you need to feel unwell at times. I mean, just like, I'm raising kids, maybe you are too, and maybe listeners, they have it too easy. They need, and so they don't have the tools to figure things out, right? Too easy is not good. Too easy for us as adults is not good. So the emotional element is up and down. The emotional element is, suddenly day 3, if you can get past day 3, you're good to go.
And can you explain why day three in the office, like why day three is so important when you do the prolong?
So day 3 is when, so the calorie intake is consistently decreases from day 1 to day 3. Day 3 is the lowest calorie intake, and by day 3 you start becoming more ketogenic. So you create more ketones and that's what you utilize for energy. That conversion of using from glucose to ketones is your body's trying to adapt. Your brain is trying to adapt and say, what is going on here? I mean, give me glucose, give me more glucose. And you're saying, nope, it's the ketones. And that's all you're having. So the body has to adapt during that time. If there is a time you could take off from work, which I haven't, is day 3. Is day 3, because that's the time. But that's the most important and critical time to stay on it and not deviate from the program. Look, okay, can you guys hire me as a Prolon? I feel like we could do an infomercial right here. Gladly, by the way. I mean, I should be hired by Prolon. I mean, this is, you hit the nail on the head. Prescribing a protocol and you as a doctor doing it is a whole different experience. And you're just more able to say to people, and the way I do it out, Joseph, I don't know if you know, I have a big audience, and I tell people, all right, guys, I'm doing this, Prolon FMD. Who's going to join me? And we get together on Zoom calls, day 1 and day 4. Hey, what's your experience? And I explain my experience. They tell me their experience with it, and I have a wide kind of feedback from my audience saying, look, I felt this, I felt that, and the other. It's a phenomenal. I have to say, and look, I don't promote stuff, and I barely even promote my own. That's how horrible I am. This approach is honestly, I don't know. I'll say it. You don't have to say it's medicinal. It's therapeutic, literally therapeutic, and more of your science is showing that.
Well, I just want to mention to everyone, this was a genuine statement. We haven't, talked about this before, but
And you guys don't pay me to say that.
but it It's a blessing to my heart because we've
Yeah.
worked for over 2 decades to get here.
Yeah.
And I
Yeah.
hear every physician, every licensed practitioner giving that feedback because it works, because they believe in it, and because they're doing it. And you and I were talking one day soon. We're preaching now. Everyone listening is the early movement crowd. Soon enough, people will realize that there's a way to audit your cells, right? Prolon audits your cells. Prolon pushes the cells to rejuvenate. Prolon helps you build your optimal weight and protect the muscle. That full rejuvenation. It's like when a race car takes a pit stop and all the engineers come in, they change
Yep.
the oil is the issue, the tires, and they fix it and they send it back on track, stronger to survive longer. And that's our mission at Lutra and with Prolon and with this summit. So hopefully, I want to thank you from the bottom of my heart for your time today, Dr. Geo, and for the information that you shared. It was very important for me today to tell the story to men and their wives and their significant others that once you have prostate cancer, it's almost like menopause. It just, hey, rethink your longevity. It's an aging clock. It's not a death sentence right away in most cases. And it's about taking care of your cardiovascular system and your healthy aging. And we want to introduce one of the tools that you can do, which is fasting, that you personally have an experience with and with your patients, just to inspire more people to rally around that movement. I appreciate you very much for the information today, and I'm pretty sure we'll do more of those in the next year or so.
I look forward to that. I'm going to add on one very small thing, if I may. The guy diagnosed with prostate cancer, the way to see it is this is the opportunity that you've been waiting for. Don't squander it.
Yes,
Don't squander
yes,
this opportunity. This is, if you're religious, this is a blessing. This is a blessing. I've heard this from people who are religious. This is, a blessing
it's
from
a
the
wake up
skies,
call.
is a wake up call. Don't squander that opportunity. Take full control and do the things you need to do so that the next X amount of years are your best years yet.
Yes. Well, thank you very much, Dr. Sheo.
Pleasure. Thank you.
Thank you for tuning in to Dr. Talks. We hope today's episode has enlightened and inspired you on your path to optimal health. Each day is a new opportunity to make choices that empower your well-being. For more insights and strategies, subscribe to our podcast and visit our website, www.drtalks.com. Stay connected, stay healthy, and join us next time on Dr. Talks. Real talks from real doctors on the issues that matter to you most.